Good morning. I'm talking to you today as part of the Governance Institute of Australia's Public Sector Governance Conference, and today I'm talking to you about better governance and data-driven decisions. We all love the notion of better governance, being able to optimise our effectiveness and productivity without creating lots of additional admin or internal red tape. Imagine if every decision we made led to the exact outcome we're expecting with no unintended consequences. Applying better governance principles to the data and the information we rely on to make our decisions is the way we ensure that our decisions are likely to lead to the intended destination without unintended consequences. So today, that's what I want to talk to you about. But instead of talking to you about governance theory and about data governance, I thought I would instead tell a couple of grisly tales. Let's start with a story about COVID. The COVID-19 tracking project in the US was set up to collect, make sense of, and publish the most complete set of data about COVID-19. The data's been cited in over 1,000 academic journals and papers. It's been used in 2 presidential administrations. It's been reported in over 8,000 news stories by the New York Times and the Washington Post and CNN, etc. And it's also been used as the basis for lawmakers to question the administration or the government about the pandemic response. So it's fair to say that these guys are the truth seekers and the truth tellers when it comes to US COVID-related data. But how were they able to get their hands on such reliable data? Well, the answer is simple. They didn't. Instead, it was an initiative of hundreds of volunteers who worked collaboratively across 12 months to review, assess, test, cleanse, and validate information from all of the individual states. The messy, inconsistent data that was being published on a state-by-state basis made national summaries comparing states virtually impossible, and it confused response efforts. The learnings from that COVID tracking project are really clear, and they're exactly what we experienced here in Australia. The first lesson is, number 1, data definitions presented issues. So, for example, how we define, here in Australia in our early stages, how we defined test numbers varied from state to state. We had some states defining total test numbers as the unique individuals who were tested, while others counted repeat testers. So there's many facets of COVID-19 data that are still not uniformly defined. So while we managed to get that one sorted out pretty quickly, there's still a bunch that's not uniformly defined. The second lesson was in relation to data availability and sharing. For example, race and ethnicity data. Is that presented as percentages or is it presented as raw numbers? And you can see the difference there makes comparison quite problematic. The third lesson was in relation to data presentation. So we're really talking about how we visualise the data for consumption. A good example here is the way COVID-related deaths are reported. So some states in the US had 2 death counts, one count using death certificates and another count using disease surveillance monitoring. And you can bet your life those 2 numbers never matched up. And that's because there's a backlog of the surveillance data. And whilst people responsible for the reporting understand that, do the public really understand those 2 counting methods and what they're there for? The project has stated its hope for the future is that there'll be better governance standards for the next health crisis. And I think the 3 major learnings from the project are particularly relevant for the public sector. And so I want to tell you some other stories where these same challenges play a part. The first story is a story about 2 lost women. Cornelia Rao, a German-Australian citizen, was unlawfully detained for a period of 10 months across 2004 and 2005 as part of the Australian government's mandatory detention program. Her detention became the subject of a government inquiry, which was later expanded to investigate over 200 other cases of suspected unlawful detention. Cornelia Rao disappeared from hospital in 2004, and then she was unlawfully detained in prison and then later the Baxter Detention Centre after being classified as a suspected illegal immigrant when she refused to reveal her true identity. Now, she refused to reveal her true identity because she believed her life was in danger. Shortly after the Cornelia Rao case broke, there was another scandal involving a woman called Vivian Alvarez. Now, her case had occurred back in 2001, but it only came to light in the public space after the Cornelia Rao case broke. So Vivian Alvarez was also an Australian citizen. She'd been living in Australia for 20 years and she was illegally deported to the Philippines in 2001. She disappeared 5 months earlier after receiving psychiatric care. When she was found, immigration officials immediately assumed she was an unlawful citizen and they deported her. Later, Vivian was awarded $4.5 million in damages and Cornelia Rao was awarded $2.6 million by the Australian government. There were lots of official reviews and inquiries into the cases, but essentially they showed that they had occurred as a result of serious administrative deficiencies. The then Ombudsman said there was poor training, deficient data and record keeping and insufficient information sharing, which led to incorrect exercise of powers. I'm keen to be clear that our immigration system is complicated and it's complex. The original errors made by officials were not made deliberately or maliciously, but occurred due to insufficient data and information sharing, and it had serious and far-reaching consequences. Like each of these grisly tales, there are a number of hardworking public officials with the best of intentions doing their jobs and undertaking their roles, but things still went drastically wrong. The second story I want to tell you about is a story about a boy and his mother. And the whole country was devastated in 2014 at the news of Luke Batty and his death at the hands of his own father. The 13-day inquest into his death made clear that there were a number of missed opportunities in the 18 months leading up to the event and a need for more sharing of information and collaboration across the system. The judge found no one agency had looked at all of the information when they were considering the risk posed by Luke's father. I take my hat off to our judicial officials, our policing, anybody who's involved in trying to combat domestic violence. They do a marvellous job and it's a very tricky space to work in. In Luke's and Rosie Batty's case, each agency had carried out a risk assessment, but they'd done so in a silo. So the judge called for, as part of the outcome of the inquest, the judge called for clear documentation of the different roles of each agency, for information to be provided to staff members from different agencies about when they can't share information and what they can and can't share, a coordinated approach to assessing risk, a common database managed by a central agency to which all agencies can have access, and the removal of impediments when it comes to the sharing of information. The next story I want to tell you is a story about 4 labourers. In late 2019 and early 2020, 4 workers aged between 16 and 25 years old died in separate workplace incidents installing foil sheeting and pink bat home insulation as part of the government's home insulation package. At the Royal Commission into the failed scheme, the then Prime Minister said his government would not have proceeded with the rollout of the scheme if it had been alerted earlier to the unacceptable safety risks associated with the scheme. However, other parliamentary advisors gave evidence that they had tried getting the risks associated with the oversight and regulation of the scheme on the table, but to no avail. Departmental officials have reported briefing the government on the serious risk posed by installing reflective foil, but that risk was not investigated further. The Royal Commissioner's final report is damning both to government and the bureaucracy. Of particular interest here in relation to better governance around data and information is the way that data and information was provided to the Royal Commission. It was provided piecemeal in over 147 separate tranches of data drops. Towards the end of the inquiry, over 1 terabyte of data containing 100,000 new separate documents was provided, which had all been held outside the official filing system. So just pause for a second and think about the cost and the time associated with having to collate, digest, understand and make sense of 100,000 additional documents tendered at the end of a commission inquiry. And spare a thought for the 4 families of those young men that were waiting for the findings of the Royal Commission to be handed down. Irrespective of which version of evidence you believe, one thing is for sure. The program's an example of government program failure, which was fiscally wasteful and led to serious unintended human consequences, including the closure of many, many businesses, and most importantly, the untimely death of 4 hardworking men. This story is a story about an egomaniac, a madman, and a robot that gets it wrong. Okay, so these characters could relate to any number of people. You've all probably got people in mind that could probably fulfill those roles. So maybe instead of pointing the finger in any one direction, I will just ask you this. Cast your mind back across the last 5 years and think about the geopolitical landscape we now live in. Could you ever have imagined a situation where the leader of a democratic country had the unfettered ability to appoint his own mates to senior roles in government, only to sack them a few months later because they didn't unconditionally follow his crazy thinking? It seems impossible, but it happened. Could you ever have imagined a situation where the leader of a country had himself sworn in to key political ministries without parliamentary or public oversight, or without the incumbent ministers being aware that this was occurring? Unlikely, but it happened. Could you see a situation where a senior government official would publicly admit to breaching the code of conduct because she lacked the courage to speak out about decision-making occurring at an even higher level of office? I imagine not, but it happened. Could you imagine a situation where a high-profile defence counsel for underworld figures becomes an official police informant, providing evidence against her own clients, leading to the potential for dozens of career criminals to be acquitted of their crimes? Yep, it happened. What about decisions made in the gambling industry, which opened up our shores to increased levels of organised crime and left unwitting casino staff exposed to detention in China? It happened. Or widespread charges for no fees by our major banks, who also exploited vulnerable customers within our communities? Guess what? It happened. And how about one of the most advanced democracies in the world allowing the retrograde step of winding back women's rights by over 50 years? Surely that couldn't occur, but it happened. In all of these cases and so many others like them, you can bet the people who were involved are now looking back and asking themselves, how did it get to here? How did that go so wrong? And the answer is really simple. It's straightforward. It started with one single decision or action. And that one decision or action was taken in the absence of, or with complete disregard to, good data, information and intelligence. It involved a lack of transparency, and it damaged trust in the ability of our governments to govern with integrity. So now for a good news story. The Australian Research Data Commons has worked to facilitate collaboration across organisations to create national data capabilities. In partnership with the bushfire community, they're developing innovative digital infrastructure solutions to improve Australia's bushfire resilience, response and recovery. The Bushfire Data Challenge program has two key areas of focus. The first is modelling fire behaviour and the second is modelling fire impact. And they do this by nationally aggregating data and models from all levels of government into one place. It is already benefiting researchers, operational organisations, flora and fauna, healthcare, infrastructure, urban planning, etc. If you have the need for cross-departmental or interjurisdictional information sharing and data exchange, I strongly encourage you to reach out to the ARDC. They are really the masters in this space and they are very generous with their advice and their knowledge. Another great example is the Galaxy platform. This is an international open source platform supported in Australia, Europe, US and many other countries to the benefit of healthcare researchers worldwide. COVID was the first health crisis in history where scientists and researchers have been able to access vast amounts of genomic data. Open data and research has played an essential role in optimising and fast-tracking responses to the pandemic. When the WHO declared the Omicron lineage a variant of concern back in November 2021, it asked countries to enhance their surveillance and sequencing efforts. At this point, the Galaxy project had been running for several months, operating a free global public genome surveillance program based on raw sequencing data deposits from countries. Among the countries that had been contributing was South Africa, where the Omicron variant was discovered. Within 3 days, the Galaxy project announced that it had its first view of the mutational pattern of Omicron, and that was now available on the platform. It was immediately available to the global research community via Galaxy. Without this platform, it may have taken many months for the Omicron lineage to be established, with more severe consequences for all of our communities. This platform is literally providing the collaborative environment for truly global, democratised, reproducible and transparent research to be used by anybody studying a disease or illness, not just COVID, any disease or illness. It's very, very impressive. And one last story about good data collaboration. In 2012, Australia and New Zealand joined forces to unite as part of the Australian-New Zealand Counter-Terrorism Committee. This committee has representation across tiers of government within Australia and New Zealand, and it's been established to build and maintain capabilities in the areas of crisis management, emergency response, command and control, information sharing, intelligence and investigation, media cooperation, etc. Through data exchange and information sharing, the committee maintains the National Counter-Terrorism Strategy. It provides expert advice and to policy heads and heads of government on dozens of terrorism-related topics. It coordinates an effective region-wide counter-terrorism capability, and it maintains effective arrangements for the sharing of relevant intelligence and information across the region. This example of interjurisdictional cooperation is recognised as an exemplar in data-driven decision-making and cooperation, and it attributes its success to 3 lessons. The first lesson is unity of effort works, partnerships matter, and teamwork is key. Now, obviously, information sharing is an important part of lesson 1. Lesson 2 is a comprehensive integrated approach works best. Global, regional, local. And the third lesson is sharing information and lessons saves lives and protects us all. Just a quick plug now about the Data Availability and Transparency Act. This Act authorises and regulates controlled access to Australian government data, and it aims to promote better availability and use of that data. The Act allows scheme entities, or which are basically Commonwealth, state and territory governments, as well as public universities, to participate in the scheme with a view to improving the delivery of government services and informing future policy and programs development. It's only available to Commonwealth, state, territory governments and public universities. It is not available to individuals or private entities, foreign entities, etc. Government agencies are encouraged to make themselves familiar with the Act and consider how the data holdings or data needs of their individual agencies may contribute to better policies and service delivery in the future. So why do you need better governance, better data governance? Well, the key goals are not difficult to anticipate based on the stories that you're surrounded by and the stories that you've heard today. But probably the most important one is this. This is the way we avoid becoming infamous or creating infamous victims like the real people in the real stories that I've talked about today. Better data governance is not a nice to have. It's essential, especially in government. And remember, the view from the dance floor is different to the view from the balcony. So get some help with perspective in relation to your decision making and your data. For a practical free self-assessment of your decision making, take a look at our free Better Practice governance model and maturity assessment. It might help highlight potential weaknesses in your decision making patterns or the data you rely on to make those decisions. I'm always also very happy to talk to you and just be a sounding board for any questions you might have in relation to data governance or better practice governance and data governance decision making. Thank you very much for listening.